Recovery from breast cancer surgery is typically not very difficult. Depending on the surgery, patients can be back to normal activities as soon as 1 to 2 weeks, but as long as 4 to 6 weeks. Your surgery and recovery may be new experiences, and we want to help prepare you for what comes next. As you recover, lean on your personal support team of family and friends to help you where needed. Here you'll find important instructions that both you and your team will need to know for you to have a successful recovery. Much about a successful recovery depends upon you taking proper care of yourself. When you leave the hospital, you will receive discharge instructions that include all of the specific care instruction for your recovery. For example, if you have a drain in place or if you had reconstructive surgery, your post-operative care will be slightly different. Keep those instructions close because everything you'll need to know is written there. You may have specific instructions regarding caring for your wound or incisions that will be crucial to healing properly. You should read these instructions carefully and refer to them if you're ever in doubt. There are some expectations and instructions that will apply to most patients. First, after your surgery, do not be alarmed by any swelling or bruising. This is all normal and common. You might also experience some pain, but it should be tolerable with enough medication to rest comfortably. The vast majority of people only require over-the-counter pain relievers like Motrin or Tylenol to control the discomfort. If your pain is not tolerable or it worsens, please call us and we can discuss other medication options that will be right for your needs. Given the recent identification of the risk of opioid addiction, we try to avoid opioid narcotics when we can, but sometimes they are required for a very short duration. You may find that ice for the first day or two helps to relieve some discomfort, but you should ask your surgeon or refer to your discharge papers, as for some procedures we do not want patients to apply ice as it may impair blood flow that is necessary for healing. An example of this would be patients who have had any kind of reconstruction. In these circumstances, we would prefer that you do not apply ice to the breasts. You'll be able to remove any gauze bandages and shower as normal 24 to 48 hours after surgery, but avoid any activity that would submerge your incisions in water, like baths, jacuzzis, or pools. Do not worry about stitches, butterfly bandages, or liquid bandages that are used to support your incisions. These will dissolve or fall off on their own over time. Most of the post-operative activity restrictions are simple and common sense recommendations to keep your body strong and avoid unnecessary stress. Pain is a good signal that you shouldn't be doing something. Basically, if it hurts, don't do it. Don't lift anything heavier than 10 pounds and avoid strenuous exercise for at least a week after surgery. You also should not drive while taking narcotic pain medications. But you can eat normally and take your regular medications. You should be able to resume activities of daily living, which we define as feeding yourself, dressing yourself, bathing yourself, and walking up and down stairs. Lastly, you should call your surgeon if you experience any kind of excessive bleeding or swelling, new skin rash or itching, pain that your medications aren't helping, high fever, or reactions from your medications. If you follow your discharge instructions carefully, your recovery will be quicker, easier, and more successful. Your surgery may have been stressful, but remember that it was a necessary step to heal your body, and it has brought you one step closer to moving past this experience. We are here to support you in any way we can as you take those steps towards recovery.